After classifying anemia using the MCV, the next step is to assess the size variation of RBC by looking at the RDW or red cell distribution width. As we discussed in the previous video, the RDW tells us how much the different size of RBCs are present in blood. So if RDW is high and MCV is low, that is, size of RBC is low, that highly suggestive of iron deficiency anemia. Indeed suggests the early stage of iron deficiency. As in early stage of iron deficiency, the most of the circulating RBCs are still normal in size. However, the newly produced RBC becomes smaller due to developing iron deficiency. As the result, you see a wide variation of cell size which lead to increased RDW in early stage of iron deficiency. So high RDW and low MCV suggest iron deficiency anemia.
And suppose if RDW is normal but the MCV is low, it indicates the more homogeneous population of smaller cells. Here, MCV tell us the size of RBC is low and RDW tell us the cells are of same sizes. In other words, less variation in cell size. This is typically seen in thalassemia or anemia of chronic disease. So in anemia with low MCV and high RDW, think of iron deficiency anemia. And in contrast, if anemia with low MCV but normal RDW suggests thalassemia. That is how we can separate the two conditions in clinical practice. And if RDW is increased but MCV remain normal, that is increased size variation with normal size of RBCs, it often point toward a mixed anemia where two different processes are happening at the same time. For example, a patient may have early iron deficiency which tend to produce smaller RBCs while also have early vitamin B12 or folate deficiency which tend to produce large red blood cells. Because one condition pushes the cell size down and other condition pushes the cell size up. As the result, the average size of all the red blood cells, that is MCV, can appear normal even though the average MCV look normal, but the blood sample actually contain a mixture of small, normal and large cells. So this variation in cell size caused the RDW to rise. And finally, increased RDW with increased MCV points toward macrocytic cause such as vitamin B12 or folate deficiency.